Hi, I'm Heather Kemsky, editor of P&K Parents and Kids magazine and your host at wickedlocalparents.com. Today we're joined by Dr. Gwen O'Keefe. She is the founder and CEO of Pediatrics Now. She's also the P&K medical advisor and spokesperson for the AAP. She'll be joining us on a monthly basis to talk about all things health-related and parent-related. Today we're going to be talking about keeping your baby safe and a bit about talking to your teens about sex. So Dr. Gwen, September is Baby Safety Month, and we all know that we need to baby-proof our homes, but what about when you're on the road, whether you're traveling or visiting someplace, or even if you're at a local restaurant? What are some things parents need to do to keep their baby's safety in mind and in check?
Well, I think nowadays people have to plan ahead a little bit. You can't really count on places having what you need. So call ahead. If you're going to a hotel, call and find out if they have a pack and play. Find out how old the cribs are. If places don't have what you really need to keep your children safe, you unfortunately really do have to bring ahead what you need. Same for restaurants. Not all places have really modern high chairs, so you may have to bring something portable. There are affordable kind of fold-up high chairs or little booster seats that you can bring even for infants that you can get at Target or Toys R Us, and you may have to look into that option.
And what about, I was always concerned with my young one getting around too, is picking up small pieces and the choking hazards. That's a big deal when you're visiting relatives and perhaps you're at a family get-together and there's a lot going on. What do you advise parents in that situation?
Don't leave your child alone. I see a lot of people even in restaurants just letting the children kind of crawl around or toddle around on the ground. You really can't do that because they can just find even a little piece of a cracker or some sort of piece that fell off somebody's purse, and those are choking hazards. So I think there has to be sort of a one-to-one monitoring going on where there's a designated adult or older teenager per child in a crowded restaurant or visiting a relative. You can't count on other people's safety proofing.
Great. Also, in this month's of Parents and Kids issue, we discussed kind of the situation up in Gloucester, where a number of teenagers had become pregnant, and kind of how that changed how you speak to your own children when it comes to, sexual behavior and the responsibilities of babies. What were the biggest messages in this article?
Well, I think that the Gloucester teen issue, and as well as some of the celebrity teens getting pregnant, have changed the entire landscape of how we talk about the birds and the bees. And parents who don't want to see that are really deluding themselves, because sexuality is creeping in discussions with kids of all ages. And any parent who thinks that a kid 8, 9, 10, and 11 doesn't know about the birds and the bees, first off, is in denial. And secondly, doesn't want to understand that kids need the information to stay safe. And so the first issue is that parents have to be honest with kids at earlier ages. And the second issue is there has to be a discussion about sex will lead to a baby, and that has to happen along with the birds and the bees. Before, we would sort of isolate those components, and we would talk about how babies are made first, and then later on, maybe in high school or even college, we would start talking about, all right, here's the deal. You have sex, it can make a baby, here's the responsibility issue. You can't do that anymore. I think teens have to understand very, very frankly, if you have sex, you will likely get pregnant, because teens don't use birth control very appropriately.
Mm-hmm. And it sounds like the parent is just a huge part of the education for a child, is talking to them honestly. I mean, I just want you to emphasize that parents talking to their child is such an important part.
Absolutely, and parents need to understand that a teen's decision to have sex is irrelevant to what a parent's beliefs are. If a teen decides to have sex, they're going to go and do it. What a parent needs to do is be willing to be there as a sounding board and be there to provide support. A parent who's willing to talk openly and honestly, those teens are less likely to get into trouble. And a parent who's not judgmental, those teens are also less likely to get into trouble. It's the parent who comes on too strong or who puts all sorts of moral judgments on all sorts of things. Those teens tend to dabble in all sorts of other issues too, like smoking and drugs, because they're trying to get at their parents. There's a lot of risk-taking and a lot of kind of let me see what I can do to push mom and dad's buttons that goes on in the teen world. Parents who take a step back and try to say, okay, I'm going to just provide information and try to be a sounding board and talk to my teens, those teens actually do okay. And somehow it works a little bit better, but the parent has to be very careful and negotiate it very easily and sometimes take a big deep breath and not say a word, and that's very challenging.
Do you have more resources on this available?
I do. I have more resources on my website. I've written a couple blog posts on it. Parents, I think, should all go see Juno. That movie handles this topic incredibly well, and the way those parents responded, I think, is a good role model for how all of us in that situation would want to respond. And I think it's probably easier to watch than to do in real life, but I think the way those parents responded to Juno's announcement of her pregnancy is how we'd all want to respond during the announcement and after. You know, you're going to be having a very strong reaction, but in the end you're going to want to respond to the child in a supportive way.
Great. Thanks for these wonderful tips.
My pleasure.